Do you solemnly swear or affirm under penalty of law the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
I so affirm.
Thank you. Have a seat.
Solid.
Yes.
Okay. My name is Dr. Rebecca Ash-Kendrick.
Doctor, tell the jury where you work.
I currently work at the Midwest Medical Examiner's Office in Anoka County, Minnesota.
And how long have you worked there?
5 years.
Where did you work before you were in Minnesota?
I was at the Office of the Medical Investigator at the University of New Mexico.
Doctor, tell us a little bit about your background, your training and experience.
Absolutely. So a forensic pathologist, which is what I do, is a physician. So to become a physician, you do your undergraduate work. So I completed that at Early College. I then went on to get my medical degree at the University of Medicine and Dentistry, New Jersey Medical School, now luckily Rutgers. And then I went on to do my pathology residency at the Johns Hopkins Hospital in Baltimore, Maryland. So what does that mean? So when you do a pathology residency, you do a couple different things. So I did anatomic pathology and clinical pathology. And anatomic pathology is a study of the body, disease in the body. So if you've ever been to a hospital and they've taken a little biopsy, they're going to send it to a pathologist and they'll render a diagnosis. So that includes parts of you and then also the full you. Clinical pathology, which is also part of my training, is a study of disease in body fluids. So if you ever went to the doctor and they took blood and they sent it off and they came back and they said, this is what your blood sugar is, etc., that's also done by a pathologist. So after completing those two residencies, I then went on to a fellowship here in Albuquerque at the Office of the Medical Investigator, and that's a one-year fellowship where we really study both the cause and the manner of death utilizing autopsy, and also multiple different modalities. So my residency really set me up for that. After completing those three things, I did sit for my board, so I'm triple board certified, and then I began my work at the Midwest Medical Examiner in Minnesota.
Are you still doing autopsies there?
Yes.
How many autopsies have you done in your
Over 1,500.
Have you been qualified as an expert before?
Yes.
How many times?
Greater than 15?
And Your Honor, at this point we would move to qualify Dr. Ash Kendrick as an expert in forensic pathology.
No objection.
She'll be permitted to testify in that capacity.
Doctor, you stated that you did your one-year fellowship here in New Mexico at the Office of the Medical Examiner at University of New Mexico. Was that were you doing that in August of 2016?
Yes, it was.
And back then, did the Medical Examiner's Office here receive the body of Victoria Martens?
Yes, it did.
What date or dates was that autopsy completed?
August 25th and 26th.
Is it typical for autopsies to take 2 days?
In a complex case, yes.
What about a regular?
A regular case would be 1 to 3 hours.
What was your role in performing the autopsy?
So I was the fellow on the case, and the way it works in fellowship is that you are the primary physician. So you've already been training for several years on how to do it, so you know how, but then you also have an attending supervisor. So I was the primary physician on this case.
Who was your attending?
Matthew Kane.
And was he there with you from beginning to end?
Yes.
Did you prepare a report for this case?
Yes.
Is there more than one report in this case?
Yes.
Why is that?
There was an amended report in March of 2017. It changed some of the wording, but did not affect the manner or cause of death.
In this case, did you actually go to the scene of Victoria's homicide?
Yes, I did.
Why did you go to the scene?
So part of your training is to understand the process from beginning to end, and the beginning really begins with the death of another. So when our office is notified as a fellow, you have the opportunity to go to scenes and understand what the death investigators do for you so that you can help them later. It's a very important part of our job, so I went along with Phil Dees to see him work.
And what was his role?
He was the death investigator for our office.
When you arrived on scene, tell us a little bit about how you interact with law enforcement and what precautions you take inside that scene.
Sure. So part of what we do is we work alongside of law enforcement. So they want to make sure everything's safe and ready to go, so we talk with them, and then when they felt it was appropriate to enter the facility, or the apartment in this case, we went along, and I walked as an observer, so I followed Mr. Dees through this. Things that we always do is I was in scrubs, so I wasn't wearing my personal clothes. You wear booties to make sure that you're not tracking things around. I wore gloves, and you're not allowed to touch anything.
Did you view the entire apartment?
Yes.
And was Mr. Dees taking photographs?
Yes.
Is that standard practice?
Yes.
For you to take your own photographs?
Yes. Very helpful.
While you were on scene, did you have an opinion about the amount of blood that you saw?
Yes, I did.
What was that opinion?
There was not much blood for the amount of injury that I was seeing.
Just moving to a few other things in the scene, did you see the orange plastic laundry hamper?
Yes.
Did you view the washing machine?
Yes.
What was inside the washing machine?
There were blankets and kind of fabric material within it.
Did you notice if they were wet or dry?
They were wet.
Did you view some knives there?
Yes.
Did you look inside the kitchen sink?
Yes, I did.
What did you notice about that water?
There was still liquid in there, and it had kind of a fatty material in it, so if you cook and you ever kind of cook off chicken, it kind of like chicken fat.
In your opinion, could that have come from Victoria?
Absolutely.
And did you notice the garbage bags that ended up containing her arms and organs?
Yes, I did.
Where were those?
Those were in the bottom of the laundry basket underneath the purse.
Is part of the job there on-site to do an on-site assessment of your patient?
Yes, I did.
And tell us what you did with regards to that.
So it was, you try to handle things as minimally as possible, but you also want to make sure that you're bringing appropriate evidence and aren't missing anything. So since I was the doctor who'd be doing the exam the next day, things I looked at were the tub, fabric around her. There was some fabric that was on the body that we then placed in the paint can, and we do that in an effort to maintain accelerants. So if there's ever a fire, one of the things that we have to be thinking about is what caused the fire and what may have been on these fragments. You put it in a paint can, it doesn't all dissipate into the air. So I helped retrieve that and put it in a paint can. And then I also looked at, after we had her placed in the body bag, at her eyes, because we were wondering, obviously there were a lot of injuries, but you don't want to go in and just have a tiny little view. You really want to stay open-minded and think, what are other things that we could be looking for? And so one of the things that we looked in her eyes for was petechial hemorrhages, and she had florid petechial hemorrhages in both eyes. So it makes you continue to think this may not just be a knife I'm looking for, but there may be other things that I should be assessing in the scene.
On scene, describe the process of putting her body into the body bag.
So I don't remember who the transport person was. So we employ a transport group. They actually drive the body bag from one place to another. But Victoria's body was brought from the bathroom placed in the body bag. The body bag was moved into the living room, and that's actually where I did my assessment of her eyes, because in the bathtub she was over on her side and kind of hunkered down, I guess, or kind of rolled down. So I couldn't get a good visualization there. So I did more of an assessment at that point, and that was the movement.
And what about the bag that was located containing her arms? Tell us about that.
So obviously, looking at her, we were missing parts. We found the bag, and the question was, do we have everything? Do we need to keep looking? And so part of my role was to palpate the bag and make sure I felt everything that we thought we could be missing. And so that was those were present in the bag.
Was that bag opened there on the scene?
No, it was not.
How was that bag transported?
It was transported in a separate body bag.
Your Honor, may I approach?
You may.
Doctor, I'm going to show you what's been marked for identification as states 372 all the way through 398. If you can take a look at these and tell me if you recognize them. Are these all photos that were taken by the Office of the Medical Examiner either at the scene or during the autopsy of Victoria Martens?
Yes, they are.
Do they accurately represent everything you described, including her autopsy?
Yes.
Your Honor, the state would move for admission states 372 through 398.
No objection.
372 through 398 will be admitted and you may publish.
Thank you. I'm going to just put up here on the screen 372. Is this the basket that you located the arms and organs in the
Yes.
bottom of?
Yes.
And I'm going to publish 373. You described putting her into, sort of moving her out of the tub. Is this what you were describing?
Yes.
Is this where you did your assessment of her, right
Yes.
here? Walk us through, doctor, what happens just generally when a body is received by the medical investigator's office.
Absolutely. So when a body is received in the facility, it is documented who's bringing it, what time it arrived, and then it'll be placed in a cooler. The way it works at the medical investigators, every morning there's a doctor's meeting. So that gives us an opportunity to sit down, review the case, review the photographs, any additional information that may have come in. In the morning, they also do a CT scan, so a CAT scan. So if you've ever had one of those, big machine, makes a lot of noise, but it gives us a very nice image of the things I can't see just from the outside. So that gets performed. That's also something that we review together at our morning meeting. After the morning meeting is completed, we assign the cases as appropriate. So it's convention that if you went to the scene, that would be your case because it's just kind of continuity so you understand the full scene. We also get an opportunity as a text back to re-review everything, make sure we're comfortable, kind of have a plan. Then when we go back, we're going to take photographs of any, both of the bodies received. We're going to document things. Is the body bag sealed? Who's there? And then we're going to take the opportunity to save things as evidence. So some of the things that you can save as evidence is swabs for DNA. You can save clothing. I mentioned before that you can save fabric, look for accelerants. You can take fingernail clippings, so it's important to clip the fingernails. You can also take toenail clippings. You can take hair for a DNA standard. You can also take blood. So there's a whole series of different things that you can take for evidence. And it's important to do that before you do any washing and before there's major manipulation, simply because the more you manipulate, the more you change things. So we take our evidence as needed. Then we're going to go forward and actually remove the clothing, wash the body, and start to really look at the body in different ways. Do I see injuries? Do I see evidence of natural disease? How much does the body weigh? What's present? What isn't? So it's just really an opportunity to step back and look at everything both in a broad light and then also take closer pictures. So as you can imagine, depending on how complex the injuries and the disease are, it can take a very short period of time or it can take a very long period of time. After the external is completed, we're then going to move to the internal examination. An internal examination is an opportunity for me to both look at disease processes, but also to look at injury. So is it injury just on the outside? Is it injury on the inside? What else am I seeing? Is anything missing? So, and if it's missing, where is it? So we really try and look at everything very broadly and then become more focused as needed. After that's completed, so we've done our evidence, we've done our external, we've done our internal, we've taken our imaging, it's the waiting game. So we have to take tissue and our blood for toxicology as well. So our best choice is blood. Then we have to move on to different tissues because if there's no blood, we still want to assess kind of what is present and what isn't. Then we have to wait. And then we also decide, are there additional studies? So I said I need toxicology. Do I need DNA analysis? We have odontologists, forensic odontologists who specialize in the dental work of the deceased. We also have forensic anthropologists, so they work on the bony structure of the deceased. So just looking at the bones, can they give us information? Sometimes it's age, sometimes it's injury, sometimes it's disease. So we have multiple tools that we can utilize, and often we try to be as thorough as we can and utilize those specialists when we can. Then once I have all of that information, we're going to sit down, we're going to look at what does this mean? What am I seeing? How does this make sense? And I'm going to come up with a cause and a manner of death. So cause and manner, although they kind of go together, are not exactly the same thing. Manner of death is the circumstances around the death. My choices are natural, homicide, undetermined, suicide, and accident. So I have to pick one of those five. What circumstances around the death fit the best? Then I have to look at cause. So cause of death is really, why are you dead? So did you have a heart attack? Did you drown? Did you get into a car accident and get blunt force injuries? If you have a gunshot wound, is that what killed you? So I need to know cause, and then with the cause, I also look at the manner, and that's what we come up with together. With my attending physician in this particular case. So we come up with cause and manner. We're going to make a report, and then that report will be available.
In this particular case, you said that a CT scan is done generally, and one was done here?
Correct.
Were there any findings in that CT scan right off the bat that were of interest?
So one of the things I couldn't see, there was a fracture of the humerus of the left arm that I couldn't see from the outside. There was no bruising on the outside, but that was fractured. And obviously, many of the things that I had seen before with the amputation of the arms and the partial amputation of the leg, the absence of the heart and portion of the liver were also noted.
And you mentioned collecting all that physical evidence. In this case, did you opt, we heard from the morphology tech, Mr. Jarvis, a few days ago, and he talked about taking, there's a traditional set of swabs you can take, or you can opt for more. In this case, did you opt for additional swabbing?
Yes, we did.
And why was that decision made?
So we want to get as much information as we can, and since we didn't know exactly what happened and there were multiple types of injuries, we wanted to be as thorough as possible. So any place we could possibly get DNA from, we wanted to try and extract that.
And you mentioned doing all of that before you clean the body. Why would you clean off your patient?
So I need to look. So if there's dirt, if there's blood, if there's tissue, I'm looking at that. I'm not seeing the skin underlying it. So I need to make sure that everything is clean so I am actually understanding what I'm seeing.
During Victoria's autopsy, who all was present? You've already talked about you and Dr. Kane, and we know about Mr. Jarvis. Who else was there?
So we have photo technologists. So their entire job is to take photographs of tissues and bodies. So we had, I believe, I can't refresh my memory.
Please.
So the photo tech on this case was Mr. Daniel Ward. We also have somebody who does the CTs. I believe that was Darla Benson at the time, but we had Darla Benson, Ryan Castillo, Michael Jarvis. Those were my technicians. As I mentioned, the photo tech, Daniel Ward. And then we also had 4 law enforcement officers. At the OMI, they're not allowed down into the autopsy suite, but they actually are kind of up above, watching down. We can talk to them if necessary. And there were 4 that we had noted there. Andrew Sue, Detective Jones, Detective Wild, and Detective Akata.
You talked a little bit about, so in this case we have sort of two things. We have Victoria's body and then we have this bag, and you talked about collecting this bag. I'm going to publish what's been admitted as States 374. You can just tell the jury what this is and why you do this before we...
So I mentioned when a body comes in, we want to document who's bringing the body in, is it tagged, so it hasn't been sealed, and this is our way of saying the date that the body was, the date of death and date of receipt, the VOR's date of receipt, came into our facility on the 24th, and then shows that the body was appropriately tagged.
I'm going to publish what's been marked as States 378. Do you recognize that item?
Yes.
Is that, what is that?
That is the bag that the arms and organs were received in.
Who opened this bag?
I believe it was myself with Dr. Kane nearby.
And I'm going to publish 379. So
This is a bag within a bag, so we opened up the outer bag, and then notice another bag, so we tried to take a picture again.
I'm going to publish 380. Can you walk us through what we see inside this bag?
Absolutely. So here you can see the dismembered arms, both the right and the left. There's some paper towel tissue. At the bottom of the picture, you can see the liver, so it's kind of glistening right there.
This one?
Correct. And then in the crook of the right arm, so right near your elbow, there's some tissue that is the posterior aspect of the heart.
We also see an amount of blood here. You talked about a lack of blood on the scene. Does the amount that was located in this bag make up for what you think was not at the scene?
No, it does not.
When was that bag examined, like during the autopsy?
So it was, so it's part of the external examination. So when we open up the body bag of Victoria, we see her body, we take a look, and then we're going to be opening up that to make sure we have everything accounted for. Because the sooner we know what we're missing, the sooner we can try and make sure we have everything.
I know you said, doctor, that you do the external exam and then you move to the internal, but instead of splitting those up, let's just walk through Victoria's body from head to toe. So starting with her head and neck, and let me actually show you 375. Is this the condition that Victoria was in
Yes.
when you began this autopsy? 376, what is this?
This is the lower half.
And 377?
This is the posterior of the lower extremities.
So this is before she's cleaned off.
Correct.
I'm going to publish 381. If you can walk us through what you're seeing here.
Sure. I'm not sure if there's as much kind of white glare, but what we do is we take a picture of the neck. Obviously, the neck is very important, so we want to get good pictures of it. So kind of where the white glare is on my photograph. So there's abrasions on the left side of the neck. So kind of red. There also with some bruise. So that's scratches and bruises, always concerning. Left and right sided. And then also, kind of, you scan out a little bit on her jaw, on the left side of the jaw, there are some contusions, correct, right there, that are oval in shape, so they're definitely much longer. They're on her face as well.
Were those bruises notable based on their shape?
They were. So one of the things that we really try to understand to get more information is what could have caused these injuries. So is it are you looking at gun, are you looking at hands, or are you looking at a hammer? So these are a pattern that are consistent with, but not only a hand.
I'm going to show you 383, and if you need me to bring you the actual exhibit if the glare is not working. Does this photo, and I'm going to actually bring it over to you because I think there is a little glare. Does States 383 depict maybe a little better the bruising that you were describing?
Yes, much better. So it's a bruise that starts, so you understand, from the corner of the lip and it goes down to this part of the jaw, kind of from the mid-cheek here down and here down. On her left side, sorry, I'm doing reverse. But on the left side, there's kind of three, they're finger-shaped. Again, I cannot exclude other things, but they are consistent with a hand.
A hand?
Or a hand fingers, so fingers.
So would that be consistent with potentially a hand over her mouth?
Yes. So additional injuries that we saw included an abrasion. So we always look at the inside as much as we can. So we're looking at the inside of her lips. There's an abrasion on the inner lip that overlies one of the great teeth, and that's consistent with something pressing on the face. It's not usually a blunt injury. We tend to see it more in an asphyxial injury. So somebody putting pressure down, maybe moving a little bit, but not a punch. So that's what we see right here. As you can tell, it kind of overlies one of the teeth. So that's going to be consistent with her asphyxial injury. So I have the injuries of the neck, both anterior and posterior. I have the injuries of the jaw. I have the injuries of her lips. I mentioned the petechial hemorrhages. We have multiple of those. So petechial hemorrhage, what does that mean? So you can get them whenever blood goes out, but it can't get back in. So your arteries pump really hard. Your veins are soft and squishy. So as you can see, these little red punctate dots, that's telling me that something obstructed the blood flow. Her heart was still pumping, but it couldn't get back in. So it goes path of least resistance, and it causes these little hemorrhages. So she had these both on her cheeks. You can kind of see them faintly, kind of towards the bridge of her nose and over her cheeks, and you can see them on the conjunctiva. You can also see them on her eyelids as well.
So for the record, this is 393, showing the hemorrhages in her eye, and before that was 394, and that's depicting your description of the pressure tooth injury on the inside of her mouth?
Correct. So we have the ability to also look underneath the scalp. So bruises don't always come to the surface. They can be deeper down. So if you've ever gotten a bruise that looks really tiny and then over time it kind of spreads, that's what I'm talking about. So we reflect the scalp and we look at there's a tissue over the skull and then there's also a tissue underneath the scalp. And there was bruising there. So she had a little on the left posterior side and also on the front of the scalp. So that's consistent with a blunt injury. That's not an asphyxial injury. So something impacted those. It's a more diffuse look to it. And again, there wasn't a contusion on the outside, so we were able to see them interiorly. These are not enough to cause concussion or knockout. They're just something you hit your head.
Talking about the inside, we talked a little bit about her neck, and I'm going to publish 384 followed by 382, which are the right and left of her neck. Underneath her skin, were you able to see injuries to her muscles?
Yes, so we do an exam. As I mentioned, we look underneath the scalp. We also look underneath the neck skin. So you have muscles that start up right at the top and they go down to your clavicle. And we're able to reflect back the skin. We can look at each muscle specifically, both the front and the back. And she had hemorrhage in multiple of her anterior neck muscles. She also had injury to the posterior of her throat. So you have muscles that help you talk. It's her posterior cricothyroid, which is just a fancy name for the muscles on the back of your throat. She had hemorrhage there. She also had hemorrhage in her erector spinae, so kind of on her back as well. So she had hemorrhage both in her anterior neck muscles and posteriorly as well.
That hemorrhage in the back near the spinal cord, is that something that's consistent with manual strangulation?
Yes.
And then tell us about her brain. What did you see with her brain?
So her brain did not have any bleeding over it, so her blunt injury to her head that I mentioned didn't cause a brain bleed. It wasn't subdural hematoma, but we look at tissues later. So one of the things we can do at exam is we can take a little bit of tissue and say, hey, what happened? And what we saw there was called hypoxic ischemic change, which just means hypoxic, no oxygen, and no blood flow with it. So I have evidence that there was not enough oxygen or blood going to her brain for a period of time.
Doctor, I think you covered them all, but is that kind of a good assessment of all the injuries from the head down to the neck?
I believe so.
So moving to her arms, I'm going to publish what's been marked, or admitted, I'm sorry, as 385. You described a little bit about the removal of these arms. Were you able to determine what type of instrument removed these arms?
So I know it's sharp. It's a sharp force injury. So I can't tell you exactly the length of something or exactly what the blade looked like, but I do know that this was most likely a knife. And you can see that there are multiple, so this is the left anterior shoulder. This wasn't just one quick little slice. This was multiple attempts to move the skin, to cut the skin. So you can see that there's kind of a V shape, so it looks like at the top you have something cutting there and going down and then maybe moving more laterally. So there's multiple sharp force injuries there. I'm not sure if we have a picture of it, but on the end of the shoulder, of the bony portion, there's also, I believe on this, I'm not sure if the picture is the easiest to understand, but there are also sharp force injuries of the head there, so of the bone there. So I have evidence of multiple sharp force injuries here.
You're talking about to her actual...
To the bone, yeah.
This, I don't know which bone that is, but her shoulder? Mm-hmm. Okay. You mentioned that you saw, and let me back up actually and ask you, you've described kind of multiple cuts. I see this instrument here. It looks like it's kind of clipped here. Why was this done?
So we need to understand how the body goes back together. One of our jobs is when somebody comes in multiple pieces, you have to make sure you have everything and how do things line up. Because sometimes in the tissue that is separated, you have information. So we try to figure out what's there. And
I see it looks like a number of kind of smaller sharp force injuries here. Is that what you were describing about sort of?
Kind of either a starting motion. We often see these in either hesitation is one of the terms that's used a lot, or like a trial. So you're trying to figure out how much pressure it takes to get through the skin. So you'll see multiple sharp force injury kind of in a line in the same area.
You mentioned that there was a CT scan with an injury you weren't able to see. This is 396. Is this that injury?
Yes.
To her left arm?
Correct, left arm.
And so what type of fracture are we seeing in this left arm?
So this is a butterfly fracture is what it's described, and it's caused by kind of a motion that involves a bend and a turn. So, yeah, this is bend and a turn.
Are you able to determine if this injury happened before or after she died?
This is a post-mortem injury. So why do I say that? I say that because we're looking at the bone and we're looking at the muscle. This is a very vascular area, and I don't see any blood. I see no hemorrhage. There was no response to the body. So this was post-mortem.
Moving to states 387, can you describe what this is?
This is the right arm,
And 388
the left arm,
and 389.
the left hand.
So looking at her hand, her skin looks wrinkly, like she's been in water, like you would see when you take a hot bath. Can you describe how this happens?
So this happens, as you mentioned, we call it pruny in my family, but you get into the water for a quick period of time and your skin kind of makes that puckering. This was likely due to the hands being in the bag with the blood. So it condenses and it's called maceration.
Going back to her arms, did you notice injuries on her arms?
So she had obviously the amputation injuries and the sharp force injuries, as I mentioned, kind of at the top of her arm. She had a couple scratches, bruises, I believe, on her left posterior elbow. Those were the main injuries, besides the fracture.
On her right arm, was there also a bruise at her elbow?
May I refresh my
Yes.
memory?
And maybe it was the left.
There was, on the right elbow, there was a red contusion and a purple contusion.
Would that be consistent with a grab to that elbow?
Yes, could be.
And do you have an opinion, going back to 396, this fracture in her arm as to the amount of force that this would take?
I do not.
Did she have abrasions on her hands or fingers?
Small, nothing, no large concerning ones.
Do you feel like we've summarized the injuries to her arms adequately, Doctor?
I believe so.
Moving to her chest and abdomen, let me... Can you show you what's been admitted as 386? Can you tell us what we're seeing here?
So this is after we cleaned, we removed the clothing, we removed the plastic bag that was around her, and then cleaned her up as well. So again, this is an opportunity for me to look at injuries and try and understand what we're seeing. So we discussed the amputation of the upper extremities earlier, and then here, I guess the two other things we haven't seen so far are going to be the big incision that goes above the nipples and down to the pubic region, as well as the partial amputation of the left hip.
Do you have an opinion here as to how her bowels kind of came out of her body?
So when you open up your body, it is no longer a closed sac. I don't know how it came out. They were, in the pictures from the scene, you can actually see that they were covered in the plastic bag, so they were out on scene. Could it have been from moving or somebody grabbing them? I don't know.
I'm going to publish 397. Can you tell us what's going on with this photo?
Yeah, so the picture can be distracting when there's lots of things behind it. So one of the things we try to do is get a good picture of each injury. And so here we used, it's called lucha, and we just placed it posterior to the wound so that we could really understand the different pieces, and then also try and reapproximate it. As I mentioned before, and you saw, we try to figure out where all the tissue goes and what we need to see.
Can you tell us what was removed from her body?
So her heart was absent, as well as the left lobe of her liver.
Was there some, I'm seeing kind of this whole, was there some bony or sternum or?
Oh, yes, sorry, the sternum also was received in the bag. So your ribs go together, there's a bone right in the center, I'm going to keep it this, I apologize. There's a bone right in the center that all of your ribs connect to, so that had been removed and also placed in the bag.
Let's talk about these cuts that I'm seeing around, around kind of this larger cut.
Yeah, so these are similar to the ones we saw on the shoulder. So when you're trying to make an incision, you don't always know the pressure, and as you use a knife more, depending on how sharp or how dull it is, you may need more or less pressure. So these are consistent with a sharp force injury to the chest. It appears to be parallel to the successful incised wound, so likely either hesitation, trial, or attempts to enter the body cavities.
Can you tell if all of this cutting and removal of her organs and sternum was before or after she died?
So post-mortem, so I mentioned before that we can look at histology. So I looked at a part of her brain, I looked at several different tissues, but we also looked at the tissue here. And this had no inflammation. So your body, when it gets upset, the first thing it's going to do is start sending out inflammation, neutrophils, lymphocytes, and we can actually look at those, and that was not there. So this would be consistent with a post-mortem injury.
You mentioned that her, well, let me move to 395 before we move on. Were any of her ribs injured?
So there was injury to, or sharp force injury, to ribs 3 through 8 on the left and on the right. So that's how you would remove the sternum.
You mentioned her heart was removed. Were there injuries? Was that removed? Well, let me back up. Was that removed in one piece?
Yeah, the heart was removed in one piece, yes.
Can you describe to the jury how your heart is connected inside your body?
Absolutely. So you have kind of 3 places where blood needs to go. You need blood to go from your heart into your lungs, you need it to come back from your lungs with oxygen, and then it needs to go out to your body and get everything there. So you have your vena cava superior and inferior vena cava. That goes into the right side. So those two different veins have to be severed. Then they go into your right ventricle and go up through your pulmonary artery, out to your lungs. That has to be severed as well. Then when it comes back in, they come into the left atria. So there's actually 4 vessels that come into your left atria. So all 4 of those have to be severed. Then you go into the left ventricle, and your left ventricle is a big, beefy one that pushes it out through your aorta to the rest of your body. And so the aorta also has to be severed for removal.
In looking at what was done to Victoria, do you have an opinion on what was cut, or can you tell us what was cut to get her heart out the way it came out?
So the sternum would have been removed, most likely, because you need access. If you're going to get your hand in there, you need to make a hole to go in to get out. So all of those would have been severed for removal.
You talked about some connections at the top of her heart. Could those have been cut incidentally to when her sternum was cut?
So she had an injury posterior to the heart, so your aorta goes up and then it comes back down, and that's the part that actually gives blood everywhere, and that's behind your heart. And so there was an incised wound to the aorta anteriorly, so that could have been done during the removal of the heart very easily.
Was there some defects inside her body, aside from what was taken out, to her aorta?
Just that one wound anteriorly, and there were 3 defects to the heart as well.
Do you have an opinion on whether or not this would be a deliberate act, removing this heart?
Yes.
There were some, I'm going to publish 390. Is this Victoria's heart?
Yes.
Were some injuries, some sharp force injuries found on her heart?
Yes.
I'm going to show you 391. Can you tell us about 391?
This is the liver, so there were
Oh, I'm sorry. That is not what I meant to show. Tell us about the injuries to her heart, not her liver.
Sure. So there are sharp force injuries. If you look, if you cut this in half and you look on your right side, kind of at the bottom, there's a sharp force defect that goes into the heart that you can see here. This is the front of the heart.
Tell me where that is. Over here?
Go down a little bit. Now go to your right. Other way, sorry.
It's okay.
Reverse.
Right here?
Right there.
Okay. So that's a sharp force injury?
Correct.
Made by something?
Likely a knife.
How many other injuries were there?
So there were 2 others, and they were considered on the posterior part of the heart. So your heart doesn't stay perfectly round when it's not full of blood and pumping. So you actually can see part of the posterior here, but the anterior has this, and then the posterior has 2 defects.
Could any of these defects have been incidental to any stabbing motions to that sternum? Now let's move to her liver. I apologize. 392. Tell us how, you said just the left lobe of liver was removed? I'm going to publish, let me do 391 first. Tell us about where that is and what part the left lobe is.
Absolutely. So your liver lives on the right side of your body. Most of it kind of tucks up underneath your rib cage and is protected somewhat. But part of it kind of comes across the middle. So depending on how large your liver is, more or less of it may come to the middle. So the left lobe of the liver is kind of a thinner portion. It's kind of like an apron. You guys can actually palpate your livers. But if you were going to cause an incision and showing your liver a little bit bigger, you would easily come to the liver. So be underneath where the incision was.
And this was also, the removal of this appeared intentional to you?
Yes.
And there are some, I'm seeing this kind of, it looks like a cut to me on 391. What is that?
That's an incised wound.
And 392?
More incised wounds. This is the front of the liver.
Could those injuries also have been through her body?
Yes.
Let's talk about her leg, or her legs, I guess. You said there was an attempted amputation. I'm going to publish 398. Does this depict that?
Yes, it does.
And I also see some what look like burns here. Can you tell us how severe any burns were to her?
Sure. These were very superficial burns. So you can have different layers of your skin get burned. This didn't go through the top layer. It didn't get into any fatty tissue or any muscle. So this would be considered a superficial burn.
Tell us about this attempted amputation and what was done here.
Sure. So your hip is not like your shoulder. So if you are deboning something, so for example, spatchcocking a chicken, you need to take the pieces apart. There are going to be some bones that are easier to get between. So if you remove the leg of a chicken, you can actually go right in the bone. People, that's how your shoulders are. Your hips are actually a ball and socket. So your hip has a femoral head, and it also has a cup that it sits on top of and around. And that's how your hip can move in so many different directions. And it also helps you walk because you can put weight on it. So if you're trying to cut through there, you can't, because you're going to come to that femoral neck, and you're not going to be able to just get into that capsule joint. Whereas in your shoulder, you can just get right between these things. So this incision here went through and attempted kind of palpating it. You could feel kind of a skinny part to get there, and then was unsuccessful.
Tell us, you mentioned this, and I think you told us a little bit about what anthropology is. Was that ordered in this case?
It was.
So how does that work? What happens?
So after we have completed our examination, there are a few wonderful people who are able to really examine the bones closely. So we work with Dr. Wendy McQuaid, who is based in Texas. She is able to review the bones and kind of try to tell us more, possibly. Not always, but sometimes they can tell you, is it blunt? Is it sharp? Maybe what kind of tool was used? So we utilize this in this particular situation in an attempt to gather more information.
Did your consult with Dr. McQuaid change any of your initial opinions about what happened?
It did not.
Did it give you any sort of new or better information aside from what you already knew?
No.
Was toxicology ordered on Victoria?
Yes.
And tell us about what type of toxicology you normally order her.
So in most cases of homicide, we do a basic exam. We can also do an expanded as needed. So what's the difference? So basic looks at alcohol, and then your basic drugs of abuse will be ethanol, methamphetamine, any of your opiates, so kind of the common things that you think of that may alter your body's function. An expanded panel is going to look at even more things. So it'll look for fentanyl, it can look for some prescription medications. We can also look for carbon monoxide. So in this case, that was important because anybody who's ever exposed to fire, we try to see if there's carbon monoxide. Carbon monoxide is a product of combustion. If you are around it, it sticks to your red cells. It does not come off easily. So if you are inhaling and exhaling, you will get an elevated level of carbon monoxide. So those are some of the different things that we can look at. Unfortunately, as I mentioned before, we were not able to get sufficient amount of blood to send off for toxicology. So all you need is 4 mils. It's not very much. That is less than what you can carry on to an airplane. So small amounts. We couldn't even get that much.
I'm thinking about when there's little test tubes when you have a blood draw. How many?
Correct.
How much is 4 mils? 1.
I need 1 of those to do toxicology, and we were not able to get enough blood to do that.
In that case, how did you proceed?
So we can look at tissue. So in this particular situation, we chose to use liver tissue and send that. That's a common tissue to use.
And what did that liver test tell you?
Do my thyroid pressure?
Please.
So when we first looked, we looked at carbon monoxide. You get carbon monoxide, you get iron, and you also get carboxyhemoglobin. So it's not as easy to look at. But we showed that it was not elevated. So it was a normal level somebody walking around would have. And we also saw ethanol in liver tissue at 210 milligrams per 100 grams. So that can be seen either in exposure, or it can also be seen as post-mortem generation. So your liver is really, really biologically active, and it has sugars in there, and one of the things it can do is it can make ethanol. It can make ethanol.
So let me just unpack that a little bit. You were talking about the carbon monoxide, and that was not elevated. What does that tell us about this fire and the injuries to her legs?
So this was post-mortem. The fire was after death.
And you talked about the liver test with an ethanol. Is ethanol normally found when someone's been drinking alcohol?
Yes.
So in this test, she did have that finding, but you've attributed it to liver activity after she was dead.
Right. So one of the things that we did do is we also sent off vitreous fluid. So if we ever get a result and we need to figure out what does that mean, we can do additional testing. So the additional testing we did is we took vitreous fluid and we tested that for ethanol, and that was not there. So this is more consistent with post-mortem regeneration.
Where does vitreous fluid come from?
That's the fluid in your eye. So you have a clear fluid. We can also test for your electrolytes. So I mentioned before, when you take blood and it goes off to the lab and you get results back, those are your electrolytes. So post-mortem, unfortunately, looking at blood does not work because, again, things keep moving and generating things. But your eye is a protected space. So it stops in that moment, and it's very good for several hours afterwards. So we looked at her vitreous electrolytes, which were normal. That tells me there was no dehydration, and she's not a diabetic. So that's the information we get there, and then also there was no alcohol present in her eye.
Were there any other drugs that were looked for and found or not found?
So we do look at an expanded panel, so it is a very long list of drugs that they look for. When we sent off an expanded on the muscle tissue, we found caffeine, and then theobromine, which is a breakdown product of caffeine, so it's in your body if you drink caffeine.
Anything?
Nothing out of the norm.
Doctor, do you have an opinion on how long, we've gone through a number of injuries, they're extensive. Do you have an opinion on how long this dismemberment and midline cut and the removal of her organs and the attempted taking off of her leg might have taken?
It would depend on your skill level.
And do you have an opinion as to, I think you said it on some of them, but just so for clarity's sake, did all of those injuries, and by all of those injuries I mean the cutting and the removal of organs, were those all post-mortem or after death injuries?
Yes.
And she did have some other, you've described some smaller scratching and things. Especially on her neck, do you have an opinion on the timing of those injuries to her death?
Those were pre-mortem, so those were before death.
Would you call this a complicated case?
Yes.
And before you submitted your report, did you consult with that team that you kind of described, other pathologists at the Office of the Medical Examiner?
Yes.
Do you have an opinion on how long after Victoria's death that any of this cutting happened?
I can't accurately say.
Can you tell us the cause and manner of Victoria's death?
Her cause was manual strangulation, and the manner was homicide.
May I have a moment, Erin?
You may.
And to really get her arms and cut her leg and cut her midline and take her organs out?
Yes, this did not appear to be skilled at all.
I'll pass it, Mr. Chairman.
Thank you. Cross.
Good morning, Dr. Ash.
Good morning.
I just have a few questions. The body of a 10-year-old should have about 2,000 to 3,000 milliliters of blood. Is that true?
Correct.
And in this case, you couldn't even get 4 milliliters for your tube.
Correct.
Okay. When you went to the scene, the body parts were inside a bag that was inside another bag. Is that true?
Correct.
And the double bag was inside an orange laundry basket.
Correct.
Okay. And was one or both of them tied in a knot, if you remember?
Both.
Both of them. So the inside bag had a knot and then the outside bag had a knot.
Correct.
Did you happen to notice a blue and white purse that was on top of the body parts inside the outer bag, I guess it would be?
The blue and white purse was on top of the bags.
Okay. So we've got a bag and a bag, and both of them, and then the purse.
Correct.
All right. Did you happen to notice a black sock there too, or?
I don't recollect.
All right. Now, when you performed the autopsy, you did not see any pink pajama bottoms. Is that right?
I would have to refer to what clothing was because it was multiple layers of clothing.
Do you want to look?
Yeah, do you mind?
Yeah, please.
The only clothing that we kept as evidence was a shirt, so no pink pajama bottoms were received.
Okay. And you answered my next question. She had a red shirt on her top.
Correct.
Now, Victoria had older bruises, like crusted scabs, like any active 10-year-old. Would you agree?
Yes.
Was there any evidence through, I think you did toxicology through tissues instead of the vial of blood, is that right?
Correct.
And was there any evidence that she had been drugged or had consumed alcohol or anything like that?
So we discussed the ethanol before. It does not appear that way now.
Okay. Now, you've mentioned some of this, but during the autopsy, you noticed a blunt injury on the top of her skull. Is that right?
Right, so there was subscapular hemorrhage on the frontal and also on the occiput.
Now, could steam iron be the object that caused such blunt injuries?
Possible.
Right. Now, I think there were injuries to her face that's consistent with a hand or a pillow being pushed against her mouth. Do you agree with that?
That would depend on the pillow. I have not seen pillows cause contusions, but the pillow compression could cause the abrasion.
Okay.
But unlikely a contusion.
And that was between the teeth and the skin. Was it in the mouth that you saw injuries consistent with something being pushed against her mouth?
Yes.
All right. Now, the evidence that somebody grabbed her around the neck and choked her to death is quite strong in this case, isn't it?
Yes.
And it includes hemorrhaging to the muscles in the back of the throat. Is that right?
Correct.
And by hemorrhage, we mean the heart is still beating at this point, and that's why you saw bleeding back there.
Correct.
Well, I don't know what this is. Posterior cricothyroid muscle, is that, I know where the thyroid is, so is it?
So it's behind, actually. So your throat is a tube, and in the front is your thyroid, and then behind that you actually have tons of little muscles that help. When I speak, my vocal cords are moving, and you actually need several different muscles to elongate them, to stretch them, and these are some of the ones that are in the back that help you move air.
This is a hard question for me, but did she suffer long? How long before she passed out?
I don't know.
Okay. Now, is it normal when someone is being choked to death that they empty their bowel and their bladder?
No.
Could that be something that happens when you're near death, or?
Yes, some do, some don't.
Okay. Now, there are a number of postmortem injuries. You mentioned the broken arm. That occurred after death. Do you agree with that?
Yes.
And there were injuries to the anal cavity as well that would be postmortem. Do you agree?
No, there was inflammation there.
Okay. Now, let's see. There were 3 separate stab wounds to the heart. Is that right?
There were 3 sharp force injuries, yes.
Now, those sharp force injuries, did they come from the outside of the body or after the heart was removed?
I don't know.
Okay. But somebody reached inside and pulled the heart out, didn't they?
Yes.
And someone purposely cut through the liver to remove one side of the liver.
Yes.
She was not breathing when someone set her body on fire. She was, you would have seen evidence if she was still alive and breathing, right?
Yes.
And this happened post-mortem.
Yes.
Now, the prosecutor asked you about, depending on the skill level, do you agree with Dr. Kane that about an hour?
Objection, Your Honor. Hearsay.
Let me rephrase.
Want to rephrase it?
Yeah.
Just speak.
Are you familiar, Dr. Kane was your supervising physician,
Yes.
attending physician at the time, is that right?
Correct.
Can you give, I realize this is a ballpark because we don't know the skill level, but what amount of time would you put on the amount of time a determined person would take to do all of this to the body?
I don't know. I cannot accurately say for many of the reasons I already described.
Do you disagree with his
Objection, Your
opinions?
Honor. Hearsay. Approach.
I've got a couple questions here. First, I wanted to show you Exhibit R as a Romeo. Do you recognize that?
Yes.
What is that?
That was Victoria's shirt.
It was the red shirt you saw her in at the scene and at the autopsy?
Yes.
Okay. I'd move R into evidence.
No objection. R will be admitted.
Second, you mentioned there was some wetness on the fingers. I think you said they pucker up like if you're in the bathtub too long. In this case, that came from it being inside that plastic bag. Is that right?
Yes.
So it wouldn't disturb any trace evidence that might be in there?
It could. So if you have liquid, the blood, it will work just like any other liquid. So it could actually remove trace evidence.
Okay. And then finally, you talked about these incisions that were used to remove the organs, right?
Mm-hmm.
Now that happened after death, didn't it?
Correct.
So if someone were to say they saw multiple downward thrusts to her middle before or during her death, you didn't see anything like that, did you?
So there is drying of the tissue in the central chest cavity, if you remember, kind of in the area of the sternum, where I can't reapproximate any wounds. So I cannot say if there were stab wounds in that area.
Did you see any injuries beneath the cavity consistent with stabbing to those organs?
So there's the post-mortem wounds, but no pre-mortem wounds that would be consistent with that.
Okay, so as far as the evidence you have, you saw no such stab wounds before or during death?
Correct.
Thank you. That's all I have.
There were some questions on cross about some anal tearing that we heard. Doctor, in the original autopsy report, there was a finding that those tears could have been consistent with a sexual assault. Do you know the opinion on those tears today?
So they could have been, but there are other explanations for those injuries as well.
Is there any other information about those injuries that you're aware of today?
Nothing specific.
Can you tell us what inflammation is?
So inflammation is your body's response to injury. So it's actually a tissue tear, or if you get a scratch or anything. I mentioned before that your neutrophils go rushing in, and then your lymphocytes, that's your chronic inflammation, they come next. So inflammation is just your body's response to something.
Was there any inflammation found related to the anal injuries?
Yes.
Or was that chronic inflammation?
Correct, yes, chronic.
Could that also be consistent with something in a 10-year-old like constipation?
Yes.
And there were also some initial findings that there could be some vaginal injuries associated, or that could be consistent with a sexual assault as well.
Correct.
Do you mentioned in this case consulting with experts. Were other experts in this field consulted with in this case?
Yes.
Do you know if there is a different opinion or an additional opinion to those findings today?
Yes.
What is that opinion?
It could be caused by other things. It's tender tissue, so it could be from a rub or something that was non-sexual.
As far as the questions that you were just asked about stabbing, I think we agree that the injuries to the internal organs were post-mortem.
Correct.
So if there was stabbing, that would have been after death. And we can't say exactly what time death occurred. Is that fair?
Correct. Yes.
We have a moment. Email. Direct and cross, kind of the timeline of this dismemberment and evisceration and all these things that happened to Victoria, that would have taken some amount of time. And if it's an inexperienced person without a general amount of time or a specific amount of time, a longer amount of time than, say, you, who does this all the time. So would it be fair to say that Victoria had been dead for some period of time by the time that her arms and organs and everything were removed and bagged and put in that hamper and the carpet cleaned and all that happened?
Yes.
Pass it, Mr.
Thank you. We just need to.
She may.
All right, you may step down.
Thank you.
All right, next witness.
Your Honor, the state will be called Detective Rich Lewis. morning, Detective.
Good morning.
We left off yesterday talking about some of the DNA that was pertinent to your investigation found on Victoria's body. Moving to some of the physical items in the apartment, a huge number of items from the scene were assessed for either latent prints or for DNA, is that right?
That's correct.
Were some of those items associated specifically with the cleanup of the apartment?
Yes, they were.
What types of items were those, or what were those items?
They were the kitchen trash bags. There was a mop. There was another trash bag that the Victoria's arms and organs were found in. There was a hamper in the living room. There was some laundry. There were some books, at least one book that was in a, what we're calling a wipes container, like a baby wipes container. Those are the main things I remember.
What about knives?
Yes, my apologies, yes, 2 knives.
Speaking about the wipes container, the knives, the trash bag at the bottom of the basket, the orange laundry basket, the unused one at the bottom, the trash bag containing her arms where the knot was, and some of the laundry, specifically the Tinkerbell comforter and the hand towel in the washer. Did any of those items have something in common?
Yes,
What was that?
it was male profile DNA.
Was Jessica Kelley found on any of those items?
On just DNA or other latent or other
On
forensic
just those
evidence?
items. Was she found on any
No.
of those items? When Victoria was carried downstairs by Jessica Kelley, was there any sign or indication that her dismemberment and evisceration had already taken place?
No, on the contrary.
What would you have expected to see?
With the injuries, for the dismemberment, I would have expected to see, obviously, bloodletting. We should have seen a lot of blood on the stairs and the stoop. I don't remember any witness describing Victoria's being, pardon me, but armless at that point, dismembered at that point.
Did some witnesses remember an arm?
Exactly, exactly, an arm flopping out.
After she's carried downstairs, which 3 people went into that apartment?
Jessica Kelley, Fabian Gonzales, the defendant, and Michelle Martens.
Detective, you have reviewed the crime scene photos extensively. Do you have an opinion as to how long the cleanup, including wiping the body, wrapping the body, moving the body, doing laundry, cleaning the carpet in Victoria's room, putting her body parts into bags, cleaning the knives, how long all that might have taken?
I do.
What is that?
My training experience, it would have taken hours.
Does it seem likely to you, based on your review of this case, that there was some removal of items from this apartment?
There had to have been.
In general, when there's cleanup at a crime scene, like washing or moving things, wiping things, does that impact your abilities as an investigator?
Absolutely.
How so?
It destroys evidence. It moves things. It makes the scene more confusing for us. It can destroy a case.
Let's talk a little bit about excuse me, who we've been calling John Doe, or the 4th person in this case. We talked a little bit about sort of the first things you did, hearing the jail call between Jessica and her sister, and then also sort of reviewing lapels as one of the earlier things that you did. In your review of the lapels from the first responders, what types of things indicated that there could be a 4th person here?
The main thing I remember from the lapels is the 3 officers that confront Jessica Kelley after she jumps off the back balcony. And then she makes some comments about another man being inside, and how he was cleaning up blood. He panicked and he left. And then she told us who that was, and depending on who you talk to, it's narrowed down to either a cote, lacote, but I think most now, after listening to it, we believe that she was saying lacote.
What does lacote mean?
Lacote is slang. It's not an exact translation, but it's slang for crazy.
Did you attempt to investigate who lacote is?
Extensively, yes.
How did you do that?
We queried not only law enforcement databases for anybody who uses that moniker or nickname. We went to the county jail, New Mexico Corrections Department, outside federal agencies looking for anything that would have matched this lacote.
What's difficult about searching a name like lacote?
A lot of times we don't know their nicknames, so it doesn't make it onto a police report. A lot of times we don't use them. It could be somebody else pronounces it differently. It's just a nickname. It's a needle in a haystack.
Were there any other significant statements from those initial, not just the lapels, but sort of the body-worn cameras or recordings from the day of, specifically when Jessica was in the hospital?
What I remember was the original investigators went to serve a search warrant to collect some standards from Jessica. And she started talking to them, and she didn't understand why she was going to be arrested because she says there was 4 of us, something like that. I'm paraphrasing. There was 4 of us in the apartment.
Was that also significant to you?
To me it was, as soon as I heard it.
You talked a little bit about reviewing jail calls. So Jessica Kelley was obviously arrested. Did you review the call to, or those calls actually, to her mother that she made out of booking?
Yes.
And in those calls, do you believe she says something like Fabian brags too much about his brothers and he called on something? I thought he was a nobody, but he talks too much. What do you believe she's talking about?
Objection, cause for speculation.
I'll rephrase. 16. Did those statements have an impact on your investigation?
They were significant to me.
Wow.
It tells me the defendant and the defendant's brothers are somehow involved in this.
So in a jail call, sometimes people sort of use code or don't talk a lot because people understand they're being recorded. What was Jessica's demeanor like in those calls?
I don't know, just almost excited and trying to tell her mother some things and almost upset. She was very loud on several jail calls.
Does she sound like she's potentially even crying?
She's upset in a lot of jail calls. She's very upset. She's crying in a lot of the jail calls we listen to.
You also made some recordings of Jessica Kelley inside the jail. Now, in contrast to a jail phone call, do inmates typically expect to be recorded inside the facility?
They do not.
Is that a common thing that's done?
In my experience, I've used that before, yes.
How common is it used, as far as you know, at this facility?
I don't know how often it's done by other officers. I've used 2 or 3 times
In your 40 years?
at this facility. We've used it at other facilities, both New Mexico Corrections, other jails across the country, and at our local jail.
Do inmates typically expect that you be recording them?
No.
Why did you decide to record her?
I felt that in conjunction with a news release, that it would be an opportunity to have her speak. I knew at that time that she was speaking openly about many things to her fellow inmates. I felt that she wanted to talk about this incident, this murder, and I felt it was a good opportunity. She would have no idea that I was there and I was recording, and I thought the statements that she would make would be open and honest.
And what were the dates of those statements, or those recordings, I'm sorry?
June of 2018, I think, maybe a week or 2 later. Without refreshing my memory, I can't give you the exact dates.
Does June 19th of 2018 and July 2nd of 2018 sound right?
Yes, that does sound correct.
While you were recording her, what was happening inside the facility? What was she observing? What was she seeing?
So that particular pod that she was in is a segregation pod. So every inmate is locked into their cell. One can come out at a time. There's a day area with a television set. She, around noon, I believe, noon, she was watching a press conference with the district attorney's office.
Related to this case?
Yes.
And the jury has heard some of those recordings, and there's one about now she's able to tell her family. What was her demeanor during that scene?
I took it as relief. I believe it was, and I'm paraphrasing without looking at the transcript, she was telling this other inmate outside of her cell that she could finally tell her family that there was another man there. And it almost seemed like relief to me.
Detective, are you familiar with Jessica Kelley's voice?
Yes.
Are you familiar with her sister Crystal Kelley's voice?
Yes.
Have you spoken to both of them personally?
Yes.
Have you listened to jail calls with both of their voices on the jail call?
Yes.
Detective, we'll come back to what we were talking about earlier with you having, you being familiar with Crystal Kelley and Jessica Kelley's voices. Are you also familiar with Lori Collins' voice?
Not as familiar, but I'd recognize it.
Have you spoken to her?
Yes, I have in
Have you
person.
listened to calls with her on there?
Yes, I have.
Detective, were you ever able to identify the specific mail that came over to apartment 808 on October 23rd, 2016?
No.
Did any neighbors see someone go into apartment 808?
Not to my knowledge.
Did that change your opinion, the fact that no neighbor saw, of whether or not this person exists?
No.
Why not?
Neighbors missed a lot of things that were going on during that time period. And it's not uncommon in a large complex like that to miss things like that. You're going to be inside your house, you're going to be asleep, you're going to be doing things, watching TV. So no, it doesn't really change my opinion at all.
Did any neighbor see the defendant fixing his car the morning of the murder?
No, that's just one example. They didn't see or remember Martinez coming over on his Harley motorcycle.
Detective, have you ever considered that this entire crime could be just Jessica Kelley?
Of course.
And how does that play into your opinion that there's a fourth person? How do you reconcile that consideration?
I can't. I'd have to be blind to all the physical evidence. I'd have to be blind to things that were said by Jessica Kelley, specifically in a panic right after jumping out of a window, making those statements, or off a patio, I mean. And then she had no idea I was recording her conversation with an inmate, so I'd have to ignore. You just have to be blind to all the evidence and essentially just ignore it.
In your experience, are people typically more forthcoming talking to their friends or talking to police?
No friends.
Have you been able to rule out any particular theory or person who might have murdered Victoria?
I know that Michelle Martens and the defendant were not there between 7:05 and 8:48 on the day in question. But other than that, I know I wasn't there. Other than that, it's still an open investigation.
What are the two things that have made this investigation extremely difficult for you?
How everyone is hesitant to talk to us. People in this investigation have minimized their involvement. People want to stay out of it, whether they're witnesses or suspects or family members. But I think the main thing was the tampering with the scene cleanup. That has completely scuttled the entire investigation.
What about time? Is time a factor?
Time's always a factor. Time's always a factor. And the longer this goes on, the more we lose witnesses, potential evidence. Time's always a factor in these investigations.
There's been a lot of criticism about this investigation. Do you find that criticism to be fair?
I think honest, constructive criticism and critique and peer review of cases is very fair, and we have to do that. As long as it's just not name-calling and things like that, but I welcome peer review. I welcome outside views. I want people to look at my work and I take everyone's view very seriously and listen to what they tell me, so I think it's fair.
Detective Lewis, I have what's been marked for identification as State's Exhibit 200. Can you play a portion of this call and see if you're able to identify the voices on it? So you said 200? I'm sorry, 300, 400, 400. I'm a little behind, so let me remark this.
As we waive any foundational issues, if they want to just play it.
All right, so 400 will be admitted and you may go ahead and publish. Thank you. I'm going to play this call. So I'm going to attempt to play this call. Start the computer first. Apologies. admitted it states 400. This is a call between Jessica and her sister from February 1st of 2017. Do you know when the bulk of the DNA started coming back in this case?
Well, after that, into late 2017, I didn't come on board till August 2017, so most of the book was well after that.
English for please enter the area code and on. Enter your PIN number now. Enter your PIN number now. This call is subject to recording and monitoring. You may be silent during the acceptance of the call. Please continue to hold. Hello, this is a prepaid collect call from Pt.2. An inmate at
Bernalillo County Metropolitan Detention Center.
This call is subject to recording and monitoring. To accept charges, press 1. To refuse charges, press 2. If you would like to say be producing, you may start the conversation now.
Hey, you could call it a better time, but it's fine for you. Hold on. Hello? What are you doing? Don't cry. I'm sorry, but all right, well, everybody has the true homies up there, they got you, Jess. Like, they're like, just I know you're gonna do that. We know this. I know. I remember, I just talked to you, remember? Yeah. Yeah.
Let me pause right there. Detective, do you recognize those voices as Jessica Kelley, Crystal Kelley, and Gray being her mom, Lori?
Yes, her mother was the first one, the deeper, raspy voice.
And she's talking about Sinner and how someone was messing with her. Did Jessica Kelley tell you at any point in the investigation that the defendant was messing with her in relation to saying that he was meeting up with Sinner?
And you could, yes, and you could also hear that on the phone call the night of the murder. Crystal was harassing her sister, Jessica.
And she mentioned something about an intervention. She thought there was going to be an intervention. Is that consistent with her statements that you've heard in this case?
Yes, it is.
Yeah. Well, I don't have everything in the hospital. My parents have over 100 bucks. I don't know what the fuck I'm Hey, I went to Pee-wee's yesterday, Jess, and like, not only is he sucking only 20 pounds, like, I don't have nothing, like, I didn't even have an ID. Like, I was supposed, I went, he said, that charger's yours. I said, the charger has engine problems. How the fuck am I supposed to get around? You know? Okay, take it. I am. Oh, it's your son. Your son's walking up. I'm standing outside all the house waiting for your son. Hold on. Yes. Okay. I cut all my hair off. So I just like faded up. Okay, my whole head. Yes. And your son just came up to me. He goes, "Yeah, I don't understand why you cut your hair. I think my hair's longer." So I didn't have an idea I was going to go see you yesterday, but all I have is my prison ID. So I already went and applied for the food stamps and all that from the first day. I need high top shoes. My leg is fucked up. So like I never supposed to walk again yet. But I got a medical approved. I need high top. I need to get your replacement card. There's a couple $100 there. Yeah, I think they're going to know. Okay. They're already issued. Hear me? Yes. Get the card. Mom, let me get the card. Make it up. I need high top. So I go to prison. I cannot go without shoes. I got a medical approved, but I didn't have it back here. Okay. You didn't get a radio or nothing? She went back the radio and I bought her batteries for it, and she said it was from you, but everything else got wrong. Okay. Yeah, because I was only there for like 2 weeks for court, so I bought some big boxers. I have a sports box that I took, and I bought you like a Fruit Loom t-shirt and shit, and I left it with my bitch. And I told her,
I said in the morning, give this to Lieutenant something with the L. I don't know. He said he was going to give it to you, but I guess it never happened. But as soon as, like, I get a little cash flow, like, I'm going to go put some money on your books, okay?
Okay, so I cannot go to prison without you, because if anybody gets fucking like, I don't give a fuck.
I know, but...
So they came down here trying to come up with me.
Oh, you would told me. I said, really? You're trying to fight my sister? She's gonna fucking whoop her, dog. I said, wait till she said she could whoop that ass.
I didn't have any more fucking switching. I got my shoes approved, so they took the wheelchair away. I just didn't move. I forgot. It's my next couple.
Okay, so what size do you want?
Like a half size bigger than you, or
So 8, because I'm in a 7.5 right now.
So my ankle is really big.
So 8.5?
Bigger, 8.5.
Okay.
I have to have my top, so Crystal.
Okay, I got you. I
don't give a fuck what kind you mean.
No, I got you. Well, what kind? What kind? Jordan?
If you give me what name, then you can do it. I'm going to keep up. We're trying to give you 7 on this distribution. I'll do 2.5, but that's the thing you take it before you're paid. If not, I'll do it 2 months, 2.5 years.
Okay, well,
Detective, we hear Jessica discussing some charges and some sentences. Was she also facing charges in another case separate from this one at this time?
Yes, she was.
And was she? Do you know if she was sentenced on that case during the pendency of this case?
Yes, she was.
it's gonna be good. You just gotta have faith. It's gonna be fine. Like, I know it. It's like, I know. See, like, I went through it too. Like, I fucking collapsed, dude. I collapsed, and I just started screaming. I said, "It's a mistake. It's not mine. It's not my sister." You know what I mean? I said, "I just talked to her. It can't be her."
She talked to Ross like at 10 o'clock at night. She was like, I talked to Ross, I talked to fucking Mia. Okay?
She says, I know it's a little hard to hear. She says she had just talked to her mom at 10 o'clock that night. Is that consistent with the call you saw on the phone records between Jessica Kelley and her mom, Lori, at the evening of the 23rd?
It is.
And also, were there calls to Nia and to Roxy or Roxanne Cordova?
Yes.
Come on, you hear me? I remember your address for the phone. You could go there and fucking see what's up with you. You was right there. Do you hear me? I fucking time to say for himself. It starts with an E, and it's 316.
And who's that?
That's Martine.
Oh, do you cousin Martens?
Yes.
I know. I talked to him. Like, I couldn't get hold of TV. I went to Freedom Cardoff, and I went at Martens, and I just broke down in tears. I said, "Look, I'm out of prison. Like, I don't care if he moved on or whatever, but I need my shit. Like, I have nothing. Like, I have nothing." And he said, "You know, with some girl Crystal over there." He goes, "Here's his number." And then so I texted him. I said, "You piece of shit." I said, "I don't want nothing but what belongs to me. So, like, what's good? You know what I mean?" And I went over there yesterday. Me too. She got all scared. She was hiding behind the truck.
I went over the fucking, I just walked around the south, I'm not, let's fucking, I don't know, fucking, just came to grocery shopping and shit. People take me by the shop, because he called and he was like, "Hello, who the fuck did you call my phone?" And I snapped, I'm like, "Hey, I'll be right there," just like, "Get down here, he didn't give me the money." I'm going, "Really?" And I was like, "I'm just going to keep getting, I'm just going to go over there and I get a chance to see what's really going on, you know?
Yeah.
I'm like, "I'm going to get this thing." He goes, "Hey, that's the rest of your bitch."
I would actually have shared any had for that guy. Yeah. And I confronted her this morning because, like, I don't know.
I'm sorry?
Because I stayed the night. I stayed the night with her last night, okay? And we're talking, and I went to go get my stuff, but we ended up going to Greg's, eating the burger, and then he passed out. So I was like, fuck it, I'm just going to go sleep here. But this morning I woke up, and I told him, I was like, I need to go to my boys, so got me off with my mom. And I told him, like, before I left, I told that girl, I was like, "I don't know what you guys got going on, but check it out. I've been in prison 2 years. Like, when I left here, I was with him, and I was in him. So I'm just letting you know that." Because
During the course of your investigation, did you determine that Crystal Kelley had a relationship? What, if any, relationship did Crystal Kelley have with Pee-wee?
At one time before she went to prison, she was dating Pee-wee.
she went out on the door late last night, and I opened it. And she said, "Oh, where's Pee-wee?" But the look on her face said it all, you know what I mean? And I said, "He's sleeping. Can you wake him up?" I said, "Probably not." But
I did go there, so I didn't give him the letter to Crystal. I didn't have a...
no, it's okay. It's okay. It's okay.
And I did check the situation, and I thought today and then that's when I thought, I think it was Martine for a night for.
That's what he said. He goes, "I was just with your sister." He goes, "Fuck, that's crazy."
During the course of your investigation, I think you've already testified to this, but Jessica just said she kicked it with Martine for a night. Is that consistent with their meeting up and him going to Harmony Way?
Yes, after the barbecue, when her half-brother William Hollis dropped her off at Martens on Espejo.
And did he at one night end up at 808, Marcia Martinez?
Yes, that was before the barbecue had been that Friday into Saturday morning.
Hey, well, hey, read it, Crystal. Read the autopsy, read it, fucking, let everybody, let it fucking know, didn't you?
I will. And I already let me know that, like, when you get there, like, you're gonna have your handful of haters, like, you know? But all the real motherfuckers, they know what's good. Yeah. And, you're gonna be alright when you get there, trust me.
I want to smash his dog.
Hey, I was doing good, yes. I was doing good. They shipped me to Springer, and then, they put Shayla up there, Roberta's niece. Oh, did you hear about my mom, Berta? That's crazy, huh?
Was you ever done this, or what?
No, not yet. Hope. Huh?
You think they want to talk to the person that, yeah, fucking I should be sick, what?
You're going with the Chinese?
I did it. The first thing I got out, I fucking went with my fucking written ID, straight fucking cash my check, and said, hey, you got cash to get your phone, bro. You can do it at fucking church, didn't you?
Yeah.
The church is embarrassing.
I know.
Fucking pop up down. Like, I was looking at everything, so like, I was doing fucking good. But fucking, I was fucking with habit, didn't you?
Now, guess who the first person I went and seen was? Lux. Yeah, she gave me a pair of black and gold Skechers. Could I walk up to nothing, you know?
Well, I don't know, my David, my other brother, my David at the house, but there's my food and whatever's in my basket, and one in my basket, there's a first full fucking identity.
I threw it all away. I threw it all away yesterday. I was going through it yesterday. I said, here, Carlos, I gave him my ID, so trying to check. I said, here's your hustle, dog.
That was when I was on fucking parole, I was fucking doing it up.
I love you.
Figured out, like, you said you're supposed to be out by yesterday was his birthday. Like, give us some things I get pregnant, like, look here.
Everything's already ready for you.
Okay, well.
And Tabitha even has the lotion. I got 2 brand new swabs before I left, and I left them with Tabitha. I think Tabitha's going to need lotion for that ass when she gets here to make sure she gets it.
Well, and I first I lost a lot of weight, and I'm starting gaining back. But I was depressed, too, and then I kind of got, who am fucking make it out? Even if I fucking don't, like, that couldn't be all good, didn't you?
It's gonna be alright. Just give it a God and pray. Like, it's gonna be alright. I promise you. Like I'm out here with nothing, you know, like nothing. Like I have 2 pairs of jeans. But the feeling like this is the first time I left with no house to go to, no kids, no boyfriend. You know what I mean? So it's hard.
Like, you can do it, sis. Like, I get it. Sharina helps you. Everybody can help you. Fucking tell her.
I know Sharina likes to live with her, but I know I already been in a place to do that.
You're gonna have to be there for my kids.
I know. Did you get any letters from me?
No.
No. Well, I got a letter.
I don't get a fucking.
Chloe wrote you and they sent it back.
Yeah, so I got one from Chloe with that day. They sent that back. Taylor Ray came through.
Oh yeah, Taylor Ray said she loves you. Diamond loves you. And Diamond wrote a letter and I got it, sent it to you. Her, you can have it.
Yeah,
But
just gotta see her for both security and both here. You know what I mean?
you got pictures? You want pictures?
Yeah, I should be getting sentenced fucking on this case within fucking 40 days. I have to have a court date.
So yeah, let me know the court date and I'll be there, okay?
Well, as soon as I find out, you guys try to get it in the mail before anything. Call my
Here, Mom.
Crystal?
I'm gonna help you whatever. Huh?
You need to help me. Like, I got copies of everything from the fucking cops in here.
Like who does? Who?
I need to see my attorney. Like, I don't
Okay.
You did take, well, I know that she got copy off on the third case, and I want to know about it.
So he's representing me on both?
He's representing me on both. He said he's going to take both cases.
I'll call him right now, okay?
Yeah, like, you guys.
Right, we'll pick it up.
He said, I don't take it 200 fucking years. I said, honestly, that's my cousin I love him. Now you can't with me, didn't he?
Yeah.
He said, you need to pick me up for this. I said,
You have one year. Jessica?
It's a little difficult to hear, but Jessica's talking about I could get 200 years, and then she says, but that's my cousin and I love him. Do you know who her cousin is involved in this case?
The defendant.
Before it comes out, I'm going to tell you something. The G code goes out the window when it's a kid. Like, if you got a hot dog, like, this is your life, your kids, bro.
I'm so fucking sorry. I don't give a fuck. People
I love you. I know. Everybody knows. They said, look, they're both beat up. You have to beat the fuck out of both of them. She walked
I'm
around.
not about taking 2 days before that for stealing from a kid. I didn't even touch it yet. You ran. But I got hurt.
But I love you. When are you? Okay, I have $15 in my pocket. Let me get at least 50, and I'll go. When do you order your commissary? Sunday? Okay, well, I'm gonna try to stack your books. I'm gonna try to keep them maxed out, okay? Like I got you 100, I got you 1,013, okay? Thank you for using computers. I got.
Detective, are you aware that Michelle Martens took a plea in this case?
I am.
And no, Ms. Dilly, we're real close to here, so I think we're going to stop here. Yes. Or you have just a couple.
I have just a couple more questions. And Judge, 371, was that admitted yesterday afternoon?
371, do you have any other record to lay on 371?
No, Your Honor, it's correct.
All right, 371 was not admitted, it was admitted now.
And Michelle Martens took a plea in this case June 29th of 2018, is that your understanding?
I don't know the exact date, but I know she took a plea in this case.
Do you know that she knew, or if she knew, about the fourth person before she took her plea?
I don't think so.
Are you sure?
Can
When did the DNA come out indicating there was a fourth person?
I see that? Could I refresh my memory on the date that she actually pled guilty? I'm confused on that.
Yes, let me show you states 371.
Just refreshing my memory.
Did she know that there was a fourth suspect at the time she took her?
Yes, it was well after it had come out. Not well after, but it was after it came out.
And you've had the opportunity to interview Ms. Kelley twice.
Yes.
And you've also studied the defendant's initial police interview.
Yes, ma'am.
Is it surprising to you in any way that they point fingers at one another?
No, that's very common.
In the defendant's interview, we've heard from Detective Brown, Sergeant Brown, and we've seen some clips and heard testimony that he kind of skips over some critical points in the night after 8:48 when he goes into the apartment with Michelle and Jessica after Victoria's dead. Is it your opinion that that's when the majority of the cleanup happened in this case?
Yes, it is.
Pass the witness room.
All right, we will take a break for lunch, and we'll come back at, let me actually, for time purposes, let me have the cards first.